Welcome to GutTalk TV, a YouTube channel focused on closing the communication and knowledge gaps in gut health.
Please see a disclaimer and press the subscribe button below.
Hello everyone, I'm Dr. Jakob.
And I'm Dr. Yoon-Kyo. We are gastroenterologists from Australia. Today we are going to talk about Ustekinumab. Ustekinumab is a biological drug, particularly a monoclonal antibody. You may also heard it as a brand name Stelara.
Ustekinumab is used to treat adults over the age of 18 who have moderately to severely active Crohn's disease or ulcerative colitis. It aims to get your Crohn's or colitis under control and keep it under control. If you have IBD, Ustekinumab may be an option for you if other treatments such as steroids, 5-ASAs, or immunomodulators have failed. In some circumstances, for both ulcerative colitis and Crohn's disease, your doctor may suggest trying Ustekinumab before other treatments. At the moment, there is limited research available about Ustekinumab in the treatment of children with IBD. However, in certain circumstances, this may be used.
Ustekinumab belongs to a group of medicine called biological drug. It is a monoclonal antibody, and antibodies are protein that recognize and sticks to a specific target. Ustekinumab sticks to two different targets, a chemical messenger called interleukin-12 and interleukin-23. Your immune system naturally makes these chemical messengers to help you fight infections, but they can also cause inflammation. Ustekinumab works by blocking the effect of interleukin-12 and interleukin-23, and this reduces the inflammation.
Everyone responds differently to Ustekinumab. Some people may start feeling better as early as 3 weeks after starting the medication, but it may take longer, and generally patients are assessed after 3 months of therapy to determine its effectiveness.
Ustekinumab is given through a drip into a vein for the first dose. Your first dose of Ustekinumab depends on how much you weigh. After you receive first dose, you receive 90 mg medication 8 weeks later that. You have this as an injection under your skin. You receive this injection every 8 weeks as a maintenance of therapy. You usually inject on the upper thigh or the tummy where you have more skin, and it's easy to grab it and then give yourself injection. If you're not able to do this injection by yourself, you can ask your GPs or friends or your family members to help you to give yourself injection.
In general, Ustekinumab is safe and has low rates of complications. But like all drugs, Ustekinumab can have side effects, although not everyone will experience these. Some side effects can happen almost immediately in direct response to the injection, such as swelling at the infusion or injection site, or allergic reactions like rash, or feeling unwell for a short period of time. Some side effects are mild and will go away on their own, or following adjustment of the dosing. Others can be more serious and may require cessation or changing of the medication.
Let your treating team know if you're experiencing side effects or you think you're maybe getting an infection. Your IBD team will recommend you what to do with the medication. Sometimes it will require you to stop the medication for a brief period of time. Also, while you're on this medication, your team will recommend you to be on certain vaccination. We will monitor your symptoms closely, especially we'll look at your symptom, but we also look at the objective markers like a blood test and stool test to make sure that how your inflammations are traveling. In some centers, they will do intestinal ultrasound to see how your bowel inflammation is doing. After 6 to 12 months of the treatment, your team will recommend endoscopy to check for gut healing, and this is an important target for treatment.
Monoclonal antibodies like Ustekinumab are transported across the placenta and therefore can be found in the blood of babies born to mothers on Ustekinumab treatment. However, studies have shown that there are no significant adverse outcomes associated with Ustekinumab use during pregnancy. Due to the Ustekinumab in the baby's circulation, live vaccines should be avoided in newborns in the first 6 months of life or until blood levels of Ustekinumab become undetectable. But all other types of vaccines should be given as scheduled. Furthermore, although Ustekinumab can be found in breast milk of mothers on treatment, this cannot be absorbed from the baby's gut and therefore is not associated with any side effects.
I hope you enjoyed this video, and if you have any questions, please leave the comments below. Thank you very much.